Hey, what's up, everybody? My name is Ken Valasillo, and I decided to do my PowerPoint on the Medicaid expansion in the state of Virginia. We can start by kind of talking about the background and the sudden wave for expansion for Medicaid. The shift is pretty clear. Perhaps the way the politics and then the House of Delegate seats have changed since the November 7th election have probably accelerated this process, maybe a little bit more than perhaps it would have otherwise. As you can tell, before November 7th, the party was heavily Republican Party, and now it's pretty even. It's Republicans just hold one more seat than the Democrats do. So yeah, when Ralph Norton was elected governor in November 2017, a huge shift in House seats began to bring new ideas and different perspectives for lawmakers. As of 4/20/2018, Virginia is part of 18 states that have not expanded Medicaid under the Affordable Care Act. I'm pretty sure that's what it's supposed to say. In a poll conducted in January, commissioned by the Virginia Hospital and Healthcare Association, 83% of Virginians supported a Medicaid expansion. So basically, what this what this page does to my presentation is just kind of see where the momentum and this big change for Medicaid in the state of Virginia is coming from, and people's voices are being heard, which is always a good thing. And perhaps real soon we can figure out some real concrete ideas and kind of execute them. Okay, so the current issues, like always, pertain to money. Current standoff entails budget differences, with an estimated 400,000 uninsured Virginians now possibly being able to apply for Medicaid. It is evident a huge budget change must be agreed upon. It is estimated that under the Affordable Care Act, the federal government would pay 90% of the $2 billion a year cost of expanding Medicaid eligibility in Virginia. Under Governor Norham's last two proposals in February and March, the remaining 10% to fund the program would be paid on behalf of hospitals. Taxing the hospitals is the idea the House has embraced, but the Senate has not. Governor has since said, I'm still willing to work with them and listen to their concerns. In addition, House Republican leaders who have been on the fence of expansion issued a statement that says the following: the start of a process that we are confident will lead to the adoption of a new budget long before July 1st. And that source was the Washington Post. So, I mean, there seems to be an agreement on behalf of both parties that this is something that perhaps needs to be addressed. Not only is it just a Democrat thing anymore, it seems to be that more and more Republicans are being okay with the idea of expanding Medicaid in the state of Virginia, something and I don't think it's ever been done. Okay, so now I can talk about Medicaid eligibility for Virginians today. As of April 21st, 2018, you must meet a category in the state of Virginia to be eligible for Medicaid. Individuals under the age of 19 are considered children, and unless the parents of that child are over the income limits determined by household composition, are eligible for coverages. In addition, individuals that are blind, disabled, or over the age of 65 are eligible as they meet a category based off of income for that individual member, unless married. Maximum household sizes too. So these people that meet the category of being age blind or disabled or over the age of 65 specifically, they may still have children or even people that they claim and are responsible for in their taxes. Can I pause this? They still only count their household maximum for their income limits is a household of two if they are married. So the income limits aren't that high to begin with. Okay, so all other individuals, that leaves a huge chunk of individuals between the ages of 19 to 64 that are considered by the state, by policy, able-bodied individuals. In essence, this means that they are able to afford, provide for their own personal health insurance. Although if they opt in for family planning or plan first, they could be covered for the following: annual physical exam for family planning, birth control purposes, including pap tests if appropriate, and sexually transmitted infection STI testing. Family planning education and counseling, birth control methods provided by a clinician or obtained with a prescription such as contraceptive, implants, ring, patch, IUDs, birth control pills, diaphragms, and Depo-Provera. So, in essence, I work as a social worker for Fredericksburg City. Anytime this Medicaid coverage is available, 9 times out of 10 people don't accept it or opt out because it doesn't cover really any health concerns, or it doesn't help you cover any health concerns if you need to go to a doctor for something, as small as a cold to something more severe. So there's a huge amount of individuals that just aren't able to have health insurance if they don't have the means to pay for it for themselves. And expanding Medicaid allows people, for example, who have a whole bunch of chronological conditions that aren't deemed disabled, but people who are just constantly sick, can't keep a job, and just have a bad luck almost. And there's a lot of them in this state, and if you happen to be one, then you would understand why expanding Medicaid for people like that who aren't able to provide for themselves, in essence, is something that's just humanitarian. The income limits are, I believe it's 138% below the federal poverty level in order to be eligible. So, and I think we go into that more in the next slide. I know this isn't very economics worthy yet, but I'm kind of transitioning and have to kind of give the background as to the importance of this and just provide some context. Okay, what expanding Medicaid in Virginia would bring to our economy. For now, only concrete policy in determining eligibility is that those individuals below the 138% federal poverty level, which amounts to $16,643 for an individual and $28,180 for a family of 3. In addition, a work requirement is a definite. Programs such as TANF and VIEW already have minimum work requirements in order to maintain cash assistance and child care. In essence, the goal is to follow a similar idea. With the incentive of offering Medicaid to those families with work requirements, it would lead to more people maintaining employment, lowering unemployment rates that are already lowering as we speak, and helping our economy as well. It is impossible to come up with factual and accurate numbers supporting the boost this will bring to the economy, but perhaps the fact that both Republicans and Democrats seem to be pushing this is a good indication. And I'm trying to find where. Okay, I guess I left it out. But this is a huge deal. I think in Fredericksburg City, which isn't the biggest locality, believe this would make 1,400 people eligible at the moment and that are within our system be able to have medical insurance. So I understand that this could go either way. This can benefit and give people an incentive to follow these work requirements, maintain a job, not file for unemployment, which just costs us money, and help them be insured, provide for their children, or it can backfire and be a $2 billion program in order to fund and just not work very well. The way that the proposition of funding this program and I think I skipped this slide. And actually, I didn't skip it, but I kind of didn't read some very important details. With the way that they're planning to budget this program is by 90% of it would be part of under the Affordable Care Act, and then 10% would be able to be funded by hospitals. Um, this is a proposition at the moment, and maybe they will tax us more or whatever the case may be. But this is something that you should perhaps, if you care about it one way or the other, be more involved because ultimately we will be paying for this coverage as well, one way or the other. So I just wanted to kind of bring limelight to this, and I'm at work and also very nervous to do this presentation, so I probably haven't done the best presentation so far. But hopefully you guys find it somewhat interesting. And if not, then I'm sorry. Thank you very much for your time.